Hi, everyone, and welcome to a special webinar where we're going to talk something about what the WHO has been in the news for recently, because there are a number of issues that have come up, and there's seems to be some sort of disagreement about how these should be viewed. So I've got two great guests with me today. I've got Clive Bates, who people who are involved in harm reduction should need no introduction. Clive was formerly Director of Action on Smoking and Health. And in 2003, he left there and he joined the Prime Minister Tony Blair's strategy unit as a civil servant. And he's worked in senior roles in the public sector and for the United Nations, and is now director of Counterfactual, which is a consulting and advocacy practice focused on sustainability and public health. And with him, we have Roger Bate, who is non-resident scholar with the International Centre for Law and Economics. He's His research is international and domestic health policy, and he's got a special interest in medicines, knows a lot about the WHO, and his writings have appeared in many outlets such as the Wall Street Journal, Financial Times, New York Times, and others. So, welcome, gentlemen. Thanks for coming along.
Great to be with you.
Right, so let's crack on. The WHO has been in the news with Trump and everything. We'll get onto that
Mhm.
later. But Roger, you and I, we authored a white paper together on the WHO, and our argument was basically that it can't be trusted with a pandemic treaty, which is what it's trying to do at the moment, is arguing for, because of its behaviour with its tobacco treaty, the Framework Convention on Tobacco Control. So do you want to just go through what our paper said and the arguments we made? And because I know that Clive might want to come back with a different viewpoint.
Sure, happy to start there. I mean, the World Health Organization's been around since just after the Second World War. It combated all sorts of important and dangerous diseases such as malaria, leprosy, yaws. It was involved with the its greatest success, which was the eradication of smallpox towards the end of the 1970s. It has had since that time a considerable number of failures. It, like many large organizations, it's become less efficient. Some people use the word sclerotic. It's just become just slow. One of its big advances, I think, was to think about trying to combat the scourge of smoking around the world, which is, I think, as well known as the largest cause of preventable death around the world, and hence reducing smoking was a good idea. We can get onto the details of that in a second. So fast forward to 2019, 2020, and the most significant public health issue since the Spanish flu, and certainly probably the biggest disruption to life since the Second World War. And they got a lot of things wrong. They believed China that it was controlling the pandemic. They believed China when it said that this was a naturally occurring virus. They provided a lot of advice that turned out to be incorrect. Now, a lot of people gave a lot of advice that turned out to be incorrect, and we can get onto that. But they, generally speaking, didn't perform in, I think, the best way to combat global health. And there are a lot of people, particularly on the right, who just think the WHO is an appalling organization. It's politically left, so rabidly left that it can't be trusted to do anything. What hadn't been analyzed was the one treaty that they had in place, because they were talking about doing a pandemic treaty, a treaty to help combat future pandemics. And the one treaty, the one global health treaty the WHO has, is the Framework Convention on Tobacco Control. And you two both know more about that than I do. But it seemed to me that it would be a good idea if we just had a look at how the FCTC had been run, because it should be an indication or potential indication as to how a pandemic treaty should be run. And we found, and I will let you two explain this better than me, that it had not done a great job with the Framework Convention on Tobacco Control.
Mm.
And I will let you respond to that.
Yeah, that's what we found. We said that if you on past evidence on the FCTC, you can't really trust a pandemic treaty to the WHO. But I met you in London towards the end of last year, didn't I, Clive? And you had a different viewpoint. You said that a pandemic treaty is something the WHO should get involved in.
Well, the thing is, I think some kind of multilateral system for managing pandemics is necessary.
Mhm.
Okay, they are unbelievably threatening events. And to be honest, I mean, it seems weird to say it, but we got off lightly with COVID-19. You could have something that has much higher mortality, much more disruptive, much higher transmissibility, and we could be still recovering from it now, and it could have done a lot more damage. Um, we also we also have to recognize that every country in the world has kind of equities in pandemic management, partly because they're on the receiving end of it, but they're also on the transmissible side of it, and they're also bound into a global system of of trade and general sort of interconnectedness. So it's something that this type of pandemic, something that afflicts all of us globally, and it isn't, maybe you can get away with it in New Zealand or Australia to some extent for a certain amount of time, but generally we can't isolate ourselves from everybody else going through it. In terms of international relations, we have to have, reasonable systems for sharing things like vaccine developments and the science that would underpin the response to these things as well. And we need to be able to have capacity in, I was living in Nigeria at the time of the pandemic, and the projections for the death toll there were just unbelievable. I mean, it didn't happen, fortunately, because there seemed to be some kind of immunity to it in the Nigerian public. But the modeling was suggesting sort of, tens, maybe, maybe up to 100 million deaths as a result of this. So that's my starting point, is that we need some sort of treaty. On the FCTC, I think it's a good idea turning sour, turning rancid, actually. I think the original idea, as it was formulated in the late 90s and early 2000s, signed in 2003 and entering into force in 2005, is pretty sound. You take what we know about tobacco control measures that more or less work, question mark whether they do, but the consensus is that the measures in the FCTC do actually work and help to change the environment for tobacco use. And then you try to generalize those and normalize them worldwide. You create what's known in policy circles as an authorizing environment. So the WHO says this is a good thing to do. And then the health minister goes back to their government and says, WHO says this is a good thing to do. So we do it. Where it went wrong, and it's been going steadily wrong, I think, since the early 2010s, has been a kind of, it's got out above, in front of its skis. It's trying to do measures for which there's no evidence, in terms of tackling ends, or as they call them, vapes or pouches or whatever, trying to be negative about heated tobacco product, trying to be negative about harm reduction in general, and seeing harm reduction as an industry strategy to undermine the convention, which it is not. But that has become deeply embedded in their psyche. And as a result, they have been rejecting this strategy and devoting more and more of their effort into fighting that off instead of sticking to the knitting, which is to generalize decent anti-smoking measures, if you like, that are proportionate, evidence-based, achievable, and all the rest of it. So I understand where the skepticism is coming from, but I think those treaties both the pandemic treaty would perform a useful function. The FCTC could perform a useful function. It's a matter of how WHO does it, and therein lies the problem. And as a result of multiple actions, loss of trust in WHO, partly because of the way it handled the pandemic, partly because of the way it handles the tobacco and other public health briefs. People are not turning to the WHO anymore and thinking, well, they're telling me what we need to do. So I think the problem is to fix the deficit in trust and credibility and proceed with these sorts of agreements. Otherwise, you'd have to invent them somewhere else.
Okay.
I
Can I just,
completely,
sorry,
if
can
I
I
can
just add?
respond, I think that's exactly right in the sense that in principle there is no doubt, and there is in fact coordination at university level, state level, in terms of information flows about viruses that where they've occurred and
Mm.
the significance of them, the transmissibility. That type of informational flow is absolutely vital, and that could be better funded. And also, in a sense, when you're dealing with poorer emerging markets, there is a certain level, it'd be called financial transfer. In effect, it's bribery. We basically need countries like, and there's a classic example like Indonesia, to share its virus samples, anything that might be risky. We need to know the information as fast as possible. And the quid pro quo is that they want a certain number of vaccines if this turns out to be a problem. That kind of deal making, if you like, that's ultimately what it is. I have no problem with it. It's like we need to be able to help countries when there's a significant problem, but we need information from them because, as you say, it becomes trite to say it, but viruses don't respect borders. We cannot protect ourselves from a pandemic without engaging with other countries. That's true. So I 100% agree that some kind of pandemic agreement needs to take place, but I reject completely the idea that WHO is competent to do this for numerous reasons. You look back to the AIDS pandemic. UNAIDS was set up because it was acknowledged in the late 90s that the WHO was a complete disaster and could not deal with it. And I would say that they're in a similar situation now. It's not that they just got things wrong. As far as I'm concerned, I mean, if you're at a cutting edge in in a market sense, but in a terms of what we're talking about here, it's like if you're on the front lines, that's a better phrase, like you're in triage in a hospital, you'll try anything to try and save the patient in front of you. And mistakes that were made in the early 2020s, I have no problem with people trying things. I have no problem with the WHO getting stuff wrong. It's when you know that you're wrong and you double down on the wrong advice and then cover stuff up about the potential risk. And the WHO is less guilty actually than the US government in this regard and many other governments. But it's like if we cannot acknowledge the failures, they are doomed to make them again. So yes, we need a pandemic agreement. We need assistance across countries, but the WHO cannot do it as it currently is established, which is why, and we can get onto this more in a second, which is why when you're dealing with a negotiation, is the best thing to do to say, which I think we could all agree on, the WHO needs reform. But as part of negotiation, is the best thing to do just to leave it, to say, as a gambit, not that you actually want to do that, but you say, I'm going to leave it until you're reformed because you're completely unconscionable as you currently are. And I'm hoping that the Trump administration's position is in fact that it's like we're walking away because you're a disaster, and that hopefully that they can negotiate some way back, both in terms of whatever happens with tobacco control, which we can get on, or nicotine control, or harm reduction, however you want to frame it, but also in terms of combating a future pandemic. Because I agree entirely, we need an agreement. The WHO in principle should be the organization to do it, but it can't do it because it is sclerotic, in some senses corrupt. It is wedded to a narrative that has been shown to be incorrect, and it needs massive overhaul. If it could be overhauled positively, then maybe we could go from there.
All right, though. I mean, there just aren't that many choices of, like multilateral fora in which something like this can come together. You've got the UN General Assembly. And then you've got agencies, specific agencies like the World Health Assembly that pull things together. I mean, if there was another forum for developing this that was, noticeably more functional, and remember, you're not necessarily going to get the right answer from the UN General Assembly either. Then okay, but at the moment, I don't think there's a pragmatic alternative to negotiating this in other than under the WHO. But I think, Roger, one thing to bear in mind that, and this is a failing in the tobacco treaty, is that the leadership in these things. I mean, WHO basically hires the room. The leadership in these things needs to come from the parties themselves.
Right.
It needs to come from the Europeans, the Americans, the Chinese, the G70 bloc, the African Union, whatever, to essentially represent the interests of member states, not the interests of a multilateral organization. And if you look at the way things have gone with the FCTC, the tobacco one, it's essentially been spun out of WHO. It now functions as a separate organization, a separate institution. The FCTC Secretariat and the Conference of the Parties are independent of WHO. I mean, there's still a lot of overlap between them, but they are not one and the same things. They're funded differently and they have their own rules of procedure and so on that is different to the rules of the World Health Assembly, for example. So it may be possible to create a multilateral forum like this. I mean, in the end, it will be the member states that make the decisions, um, and create a separate treaty instrument from the World Health Assembly, or something brokered by WHO that is separate to WHO when it's implemented and gives WHO you know, not so much of a role. I mean, this has been done with the Climate Convention. It's called the UN Framework Convention on Climate Change, but all the running and all the action is now with something called the Paris Agreement, which is a creature of the Secretariat for that and the member states and the subsidiary bodies of the climate agreement itself. So it's like not quite standalone from the UN, but it pretty well is in
Mhm.
many respects. It's quite at arm's length. But this is where I think essentially WHO creates a forum, but the member states have to take the responsibility. And I think the problem with the pandemic treaty is it's just extremely difficult to agree. It's extremely difficult to know what a pandemic will be like. It definitely won't be like the last one. It could be much worse. It could be very different. It's definitely difficult to know what the response will be like, how what measures you would need to control it. Do you have, no fly zones, or do you, I don't know, do you stop all trade or all movement of people? So I think in those conditions of uncertainty, most particularly rich countries where they have the capacity are sort of unwilling to open up
Mhm.
to if you like, addressing a collective action problem, when they think that when it comes to it, they will be very, very focused on addressing the problem as it is within their own borders. And that's the underlying difficulty.
Okay, you mentioned there, Roger. We'll move on to America because you mentioned America there, and maybe America's more guilty of the WHO. And of course, the big news was that Donald Trump came in and he pulled out of the WHO, and Javier Milei in Argentina's done the same thing. Now, one of my roles is working with American companies. I know their position is quite favourable, and I think in America, I've sensed there's a lot of support for this. But I think both of you are in agreement that maybe that Trump shouldn't do that. So, Roger, what's your views on that one?
Well, just backing up a second, because I think again, Clive, I think makes enormous amounts of sense. I think that one of the issues that we're seeing now with all of the Elon Musk efforts, whether you like them or not, to expose, maybe there are lots of bad adjectives you could use, but in kind of look at the level of waste and abuse and corruption there may be in agencies. One of the things that I already mentioned, AIDS, and the fact that UNAIDS was set up, but also that the Global Fund to deal with tuberculosis, malaria, and HIV was established as a vehicle. And I think one of the things that needs to be looked at is the possibility of renewal of new agencies. And
Mm.
it's like no existing program ever wants to go away. Bureaucratically, if you have your budget, you want to spend it so that you get that budget next year. That's one of the problems within government, is that kind of thinking exists. And it's like, I would say that the Global Fund was excellent in executing its role. And I would have no problem. I would have concerns about its long run. But I would have no problem if you set up a new agency called UN Pandemic, that sole role was to come and get everybody together, because it involve new people to come up with a new agenda. And generally speaking, from my experience of looking at US government agencies, something that's set up new, it's far more responsive. The oversight is better from Congress. The oversight is better from the media because they're paying attention. But as soon as someone's been in the role for 20 years, it just doesn't function as well. So either you have a coalition of the willing, if you like, you pick the world's democracies that want to do something about it and try and build from the bottom up, and then hopefully the WHO or another agency takes it, or you start something new from the top. The I'm hopeful that that's where the US this administration tries to lead us. I'm not sure that that's going to happen. But one of the things, the positives that could come out of Trump and Milei pulling out of the WHO is for people to realize how much do we need the WHO? What do we need it for? Because I think that the constant renewal, the constant question asking about what is an agency for, what's an organization for? Because the main role of the WHO, if you go back to the late 40s, was to do exactly what it needed to do during the pandemic, which was coordination. It wasn't funding everything. It was coordination, informational exchange, getting people around a room to say, or virtually, how are we going to deal with this? Because Clive's right. We don't know the form of the next pandemic. We don't know how dangerous it's going to be. But the last thing I would say in terms of what the US needs to do, we need to learn from best practice. And in the smoking and vaping space, the UK has got a lot of this right over the last 5 to 10 years. You guys know more about this than I do. When it came to the pandemic, Sweden got nearly everything right, but it was held up as a pariah because it didn't enforce lockdowns. It basically said, we trust our population to do sensible things, which meant isolation. They had short run spikes, but they have lower overall mortality than most other nations. They didn't shut a school for a single week. And the impact on the wider impact of COVID lockdowns is so vast that I think half of America no longer trusts any form of lockdown. And if we were to have a pandemic where the mortality rate was 10%, I could see it running wildfire through the United States because there is total distrust of the agencies, domestic as well as international. So pulling out of the WHO, if it's a gambit to renegotiate better terms and to push for reform, then I'm all for it. If it's just pulling the drawbridge up, it won't work.
Yeah. Roger, I mean, UN pandemic, okay?
Right.
The reason the UN looks like an overdressed Christmas tree is exactly that kind of approach. Every time there's a bloody conference,
Right.
a new agency gets set
Right.
up. So we have UN Women, we have UN HIV, it's a terrible way. And if you're Elon Musk and you're interested in waste, you
Right.
definitely don't set up parallel infrastructure. WHO has regional offices, it has people in every country. It's an infrastructure ready to do things that does not and should not be duplicated if you're interested in waste and efficiency.
Right.
And I agree with you actually on Trump. It's in some ways it's not surprising because he's done it before. He did this in his last term. But the question is to what end? And I don't believe Elon Musk is going around finding waste and efficiency. He's finding things that he doesn't like and putting a wrecking ball into them. And I don't think there is a real systematic approach to waste and efficiency because in waste and efficiency exercises, you look at the output and the outcomes, not just what the money's being spent on and whether it has a trigger word in it that you don't like. So for me, I would, in a reform agenda, I would take the existing infrastructure and I would get it back to fundamentals. Okay. If we just take the exercise, if we didn't have a WHO, we'd have to invent one or invent something like it. What is that thing that it needs to do? And it's mainly focused on infectious diseases,
Right.
mainly focused on leveling up healthcare systems in poorer countries, providing sort of technical advice on that sort of thing, trying to sort of even up improve the efficiency of healthcare systems, deal with transboundary issues. Okay, now smoking, vaping, whatever, not transboundary issues in any sense, unless you conceptualize the tobacco industry as some kind of transboundary vector. But if you focused it on the things that it must do, and then you fired all the people that do other things than that, and then rebuilt it around efficiency and delivery on the things that it must do, then that would be a good reform agenda. And my hope is that is what would happen as a condition for the American money coming back in.
Right.
Now, so far, I have seen no sign of that. That we are leaving. When Trump says we're leaving the WHO, it's not we're leaving the WHO until, or we're staying in the WHO unless. It's we're gone. We're out of here and we're blowing it all up. And that afraid, seems to be the sort of disposition of the administration, rather than using its muscular money as a way of seeking reform. But if that was something that they became interested in, then I do think there is a good reform agenda for WHO, and it could potentially be the place, the incubator, if you like, for some sort of pandemic response system, which itself could be then spun out like the FCTC or the UNFCCC has been into something that's more a creature of its member states than the sort of plaything of the WHO itself.
Look, agree with quite a lot of that. I mean, my main concern about many of these things is that they don't become run by member states, but they become run by cliques within the bureaucracy, or as people would call it, the administrative state itself. So that these things are not run for the benefit of smokers, or rather those who are trying to quit smoking. They run for the benefit of the kind of public health bureaucracy. And this is where I think that you and I will have to agree to disagree about whether Elon Musk is finding waste and abuse. You're right, he's targeting things he doesn't like, but I also think that they are trying to cut things that the left love. The whole DEI woke infrastructure and everything. I mean, the number, my alma mater, the number of hundreds of jobs that are associated with things that actually I don't think increase productivity at all within a university. It's like, I think there is a fundamental difference in opinion between left and right here, and we can agree to disagree maybe on that. But it's like, I agree with you that the reform is the preferred option. I think you and I are on the same page. I think Martin as well, that the WHO well run is invaluable, both in terms of coming up with health regulations, be it a pandemic treaty. The question is, can it be reformed? That's the first thing.
Mm.
And secondly, as I said at the beginning, negotiation tactics are often, this is my final offer when you come to the table, which it would be the equivalent of, we're just walking away. Because if you actually throw out an olive branch too early, people say, oh, we can just carry on as we were before. So I'm not expecting it, but I'm hopeful. This final decisions about WHO will probably come from the State Department and Marco Rubio's office. So it's really kind of interesting, and I'm trying to find out through, not exactly back channels, but trying to find out exactly what interest there is, because there are smart people, there are bad people, there are dumb people. With any large administration, but there are people there who I'm trying to get asked to the question, a bit like,
Mhm.
maybe Iraq and Afghanistan in the early part of this century is, okay, so you've won the war, you had the might to do it. What comes next? And
Yeah.
the question I want answered from the administration quietly is, okay, you walk out of the WHO, what comes next? 193 nations will still be in it, and you won't be able to influence things
Mm.
if your money isn't there. I mean, interesting to me, and you guys again know more about this, the kind of tobacco group within the FCTC is funded by the FDA. Yet the United States isn't a signatory to the treaty. So it's like, how how do we move forward with that? How can we get the United States to re-engage on these global matters? And hopefully the Rubio office, the Secretary of State, actually wants to pay attention to this. But I don't know. What comes next is not something that I believe they've answered yet.
I just want
Well,
to say we've got
sorry.
less than 5 minutes left. I wanted to raise that the Global Tobacco Regulators Forum, which Roger just hinted to there, just for viewers. This is a forum which isn't global in any sense. It's just it's a collection of countries, most of whom are anti-harm reduction, which, like Roger said, is funded by the FDA, which isn't even a signatory to treaty. So, how will this movement to remove themselves from the WHO affect the FDA and other agencies like that in America, Clive?
I don't think this will make much difference to the FDA. It may mean that they have to pull out of that Global Tobacco Regulators Forum, but that isn't their biggest problem at the moment. The biggest problem is people crawling all over them, asking tough questions about how they spend their money, why their processes are so slow. And once you lift up the drains on FDA and the Center for Tobacco Products, there's some absolutely awful things to discover down there. The cost of that process, the PMTA process, the bias against small and medium-sized entities, the misuse of the legislation appropriate for the protection of public health. standard, the fact that the market is 94% unauthorized, that it
Yeah.
costs 20 to $100 million to get a product approved, that it takes years to get through. And essentially, they've ceded the whole market to Chinese and other unauthorized products. You take one look at that, you don't have to be Donald Trump or Elon Musk to find something wrong here. You just have to be a normal, rational sort of policy analyst. And anyone on any side of the aisle with any political disposition would find the US FDA Center for Tobacco Products and the approach to tobacco nicotine regulation wholly unsatisfactory. 14,000 combustible products, 34 vaping products. How can that be right? It's a total mess.
I've got one question if I could throw in there, because again, I looked very much at the vaping space as an amateur, if you like. One of the things I did was speak to a variety of retail outlets in the Philadelphia suburbs where I live. And they are, as you said, something like 90 to 98% of the products that they were selling were technically not legal or not authorized in the US. This does seem to be, and this is being viewed as a positive in some places, but the FDA seems to be starting to clamp down on some of that. But that means that the market's being driven underground. I did a project on opioids
Yeah.
about 10 years ago, and I know some of the illicit dealers around this area, and they're now beginning to sell disposable vapes where they never bothered to before. That's going to make the market even more dangerous because you're talking about the worst players in humanity, kind of drug dealing types. So, do you, just a couple of minutes, do you see the FDA clamping down in all the wrong ways? Do you see that anything good coming out of the new
Oh,
administration?
I mean, there's demands on the FDA to like clear the market of
Right,
all, illicit, unregulated products. And if it did that, it would be a public health catastrophe.
right,
I mean, there are, 20 million people vaping in the United States now. And that means about 18 million of them are using unauthorized products.
right,
So that's a lot of people to take their daily vaping habit and just throw it up in the air.
right,
On the other hand, Roger, you're totally right. If we are relying on, the social responsibility of criminals to supply a harm reduction product, then we're in a really stupid place.
right,
And the answer to this is not to clear the market, but it's to authorize thousands more products, not just have 34. And I've said, well, why not at least set an objective to get 4,000 vaping products authorized and on the market? Because that's roughly the number of cigarettes that are authorized and on the market. I mean, how wrong can that be to have an equivalent diversity? But to do that, they would need to radically overhaul the process that they use as the route to market and essentially the near insurmountable barrier to entry that they have to the market. And therefore, a massive reform agenda is required to cause that to happen. But that's what should happen. When you've got 4,000 vaping products on the market, then you're in a much stronger position to take action against the remaining, and there's probably 60,000 different disposable
it's
products on the market
amazing.
at the moment.
It's astonishing.
So, and those are mostly Chinese.
Yeah,
I mean, there's nothing wrong with them, or there's nothing wrong with most of them.
right,
They're perfectly reasonable products. They've just not gone through the authorization
right.
process. And there's no reason why you should exclude good Chinese products from the US market.
Agreed.
But there are rogue products in there. There are stuff that's badly made, badly mixed, contaminants, all the rest of it, that you should be keeping out of harm's way. And you certainly shouldn't be having criminal networks involved in the supply for all the reasons you say. They are supplying all kinds of illicit products, not just vapes.
Absolutely.
I'm going to have to stop you there, gentlemen. I could talk about this all day. Thanks very much. It's a great conversation. I'm glad we held it, and hopefully we'll be able to talk about it again someplace. But I'm sure the debate on the WHO is going to rage on amongst consumers and the public alike. So thanks very much for joining me, Clive and Roger, and goodbye from this special episode, and thanks to our viewers for watching.
Pleasure.
Thank you.
Thanks.